So I wanted to say thank you to everybody for attending. Today's NDBN webinar is going to be about toilet training, and our speaker is Dr. Edward Christophersen, who's with Children's Mercy Hospital in Kansas City. And Dr. Christophersen is an expert in early childhood psychology and behavior. He's a clinical psychologist and professor of pediatrics, and he has spoken and published on a number of topics, including numerous childhood problems and treatments that work, but today he's going to speak to us specifically on issues surrounding toilet training and how the diaper banks can help their parents and clients and caregivers with information and treatment programs that will truly work when it comes to toilet training. So with that, I'm going to pass the presentation over to Dr. Christophersen.
Oh, thank you, Susan. I have to do this, it's a hospital requirement, just disclosure saying that I have several books that are available, and if somebody were to buy a book, I'd get a quarter, so that now you know my disclosure. What's the best method of toilet training? We don't have a clue. What are the main choices? The two main choices that are widely available are Brazelton's, what he called the child-oriented approach to toilet training. He originally published this in the early 1960s, and to the best of my knowledge, as of today, no one has ever actually evaluated the child-oriented approach. The other major approach is Azrin and Fox. They have a popular book called Toilet Training in Less Than a Day. I think the last time I checked it, it sold 3 million copies, and that's probably had at least 100 published research papers on it. The child-oriented approach, and this is the one that's probably the more popular and the one that people are more accustomed to, you place a potty chair out in the open where the child can sit on it any time, so that for people who approve of their kids watching a bunch of TV, you might put the potty chair in the room where the TV is. They sometimes put the potty chair in the kitchen. They basically put the potty chair almost anywhere. And the next one is directly out of Brazelton's 1962 paper, where he literally used the word reward the child with a cookie for elimination in the potty chair. So what you'd have is a child sitting initially with fully clothed, where you just want them to get very, very used to the potty. And you take your time. There's really no hurry on this. The toilet training in less than a day is a very, very highly structured program, so much so that the average parent or daycare worker probably would not do the full toilet training in less than a day. We did it with both of our kids and our children, and it probably took, 5 to 7 days to do it. You start out with a doll that wets, and that was a bit of a challenge because the doll that wets literally is a doll that has a little plastic tube that goes from the mouth to the doll's bottom, so that when you squirt water in the mouth, the water squirts right out the bottom, which, I mean, kids are fast, but they're not that fast. You have the child practice with each of the component skills. You have them practice, bending and sitting on the potty, getting up from the potty. You have them, what we did when we did this was we had a little syringe that had water in it, so we could kind of disguise that behind the doll, so that when we pushed the plunger on the syringe, it looked like the doll was actually urinating in the potty chair. You fill the child up with lots of fluids during the day, and I mean lots of fluids. The fluids are available continuously out through the full day. You have rewards for completion of the components. And part of the components are actually taking the doll through the various steps before you ever try to get the children to go through the various steps, and there's vast research support for it. How do most people toilet train their children, or the children they're responsible for? They probably adapt some features of each. Does it matter how children are toilet trained? We don't have a clue. Nobody has ever compared the two sets of procedures, at least not, and published it in the research literature. So where do you start? Most people would agree, not all, but you can't get agreement on it, from everybody on anything. Most people would agree that there's a point before which it's probably silly to try to toilet train a child. And except for the people who are advocates of infant toilet training, most people would agree that it's difficult to toilet train, say, a 6-month-old or an 8-month-old because they can't get to a potty chair. They can't lower their clothing. They can't sit down. They can't stand up. They can't do any of the component pieces. So what are the pieces that we look at? One is bladder maturation. Below about 24 months of age, kids, and they don't actually dribble, but it seems like they're wet a lot. And above about 24 months of age, probably plus or minus 4 to 6 months, they will actually fill their bladder, then empty it, then fill their bladder, then empty it. And that's a good sign that they are now ready to be toilet trained, regardless of what age it occurs. There's nothing parents can do to speed that up or to slow it down. Language skills, it helps if the children have names for what we're talking about. So, and I usually say don't teach the child to urinate and defecate because they might be 5 years of age before they can actually say urinate and defecate. So they may go poo-poo, they may go pee-pee, whatever your culture and your family dictates. Motor development, if the child can't get to the toilet and back, if they can't get on the toilet or the potty chair, if they can't raise and lower their pants, it's very difficult to toilet train them because a child that could get to the toilet and knew that it was about time for them to urinate, if they couldn't get their pants down, they would urinate in their clothing. So it helps if they have motor development. Compliance refers to whether if you can't get a child to do anything that you ask them to do, it's not a good time to try toilet training them. There's a very good chance that it's just going to fail if you try to toilet train them when compliance is a big issue. Got to get the arrow. Okay, bladder maturation, I said was about 24 months of age. Vocabulary, pee and poop, don't use, urinate, and defecate. You need to be able to get on and off the potty chair or the toilet without assistance. If you're using, and I'll say this again later, if you're using a toilet rather than a potty chair, it's a good idea to have 2 steps or 1 wide step so that the children can place both feet on the step. And I have a picture of it, and I'll show you that. And the ability to raise and lower their pants without assistance. It helps if they have loose-fitting pants. Here it is. This is a commercially available product that I found on the internet. I don't have anything to do with the company. I think it's from Great Britain. It's called the Looster. And you notice on this slide, the child has their feet spread apart. And since that's the way most adults will sit on the toilet with their feet spread apart, most people don't poop with their knees together. What you want to do is have either 2 steps or have it be wide enough. The Looster has the advantage that it's real easy for a child to come in and they don't have to carefully place their feet because they can put their feet on that and turn around and sit down. Compliance, if you ask the child to point your nose, point your ear, point your chin, your hip, and they won't do that. If you ask them to come here and they won't do that, if they just are basically non-compliant, then it's a good idea to work on compliance prior to the time that you ever start the toilet training. The nice thing is that the motor skills can be practiced before you start toilet training. The language skills can be practiced before you start toilet training, and any issues with compliance can be addressed literally for months before you start toilet training. The more of these components that you have mastered on the child's part before you start toilet training, probably the easier the toilet training goes. I got to get the arrow perfectly. Bowel Readiness. Most of the children who are easy to toilet train will predictably have a bowel movement within 10 to 15 minutes after eating a meal. Many children who are difficult to train have had problems with constipation. I've seen figures as high as 90%. If you think about it, if one child is pooping almost randomly, sometimes 2 or 3 times in a day, sometimes not at all, and you can't predict within an hour or 2 when they're going to poop during the day, it makes it much, much less likely that when you place them on a potty chair or the toilet that they're going to actually be successful. For the kids that are, quote, easy to toilet train, they eat a meal, 15 or 20, 10 minutes passes, and then they have a bowel movement. It's much easier to catch them when they have the bowel movement and have it be in the toilet. Constipation does not mean the how often children go between bowel movements. Normal is anything from 2 stools a day to 1 stool every day. What constipation means to us is that the child has difficulty passing stool, straining when they're trying to have a bowel movement. The more they strain, it's not uncommon for me to see children that can routinely go 7 to 10 days without a bowel movement. It's just, I don't want to try to teach a child something if the behavior is only occurring every week. It's much easier if it's occurring every day or twice a day. This we just put in here to make the point about functional constipation. At least 1 episode of fecal incontinence per week, which just means pooping. Most times this would be in the diaper. To pull up a history of retentive posturing or excessive voluntary stool retention, which just means when they do have to poop, they won't poop. They try to hold it back. A history of painful or hard bowel movements just means that you don't want to associate discomfort or pain with any normal bodily function. If children have difficulty passing stools, then the next time they feel as though they're going to have a bowel movement, they're much more likely to try to hold it because they don't want to be hurt. And in the presence of a large fecal mass in the rectum, I presume that the average parent or daycare worker can't detect the presence of a fecal mass in the rectum until it's large enough that the belly's distended, and a history of large caliber stools that may obstruct the toilet. We've had a number of kids where the parents had to use a plunger, or they would use some kind of a stick to break up the stools to get them through, down the drain. The time criteria is that these symptoms occur once per week for at least 2 months. Next one. Health utilization and cost impact. Again, I just put this in because the cost in terms of health care in the United States is $3.9 billion a year for constipation. And since constipation is the most frequently encountered condition that makes it difficult to get kids toilet trained, we don't want them to have problems with constipation. The mean outpatient cost for constipation is about $13,900. Compare that with the child who doesn't have problems with constipation, where their average health care costs are $3,500 a year. It's a huge difference, a difference of factor of almost 4. Management of constipation, and I'd say fruits and vegetables, knowing that some parents will say that their children don't like fruits and vegetables, but fruits and vegetables help to counter constipation. There's a very nice rule of thumb for how much dietary fiber kids need. A 4-year-old should get 9 grams of fiber a day. A 5-year-old should get 10 grams of fiber a day. A 3-year-old should get 8 grams. It's just age plus 8. We don't have any research comparing natural fiber with supplements. So what we usually tell parents is that it's fine if they use a sports bar or something like that. Or Fiber One has a number, I think that's a company name, Fiber One or brand, where they have a number of different things that are probably at least 3 to 5 times as much fiber. Like Fiber One bread is much more fiber than regular white bread. Exercise, vigorous exercise every day helps to stimulate the bowel, helps to keep the kids regular. They just had the Boston Marathon, I think yesterday or Monday. I guess yesterday was Monday. If you notice at marathons, they have those little porta potties along the entire route, all 26 miles, because that kind of vigorous exercise stimulates the bowel. And it's not uncommon for people to have to stop during a race because they have to poop. You may need to decrease dairy intake to twice the minimum daily requirements, which the rule of thumb we use is 12 ounces a day of cheese, cottage cheese, milk, ice cream, custard, yogurt, and pudding. So that's twice what a child actually needs in a day. And we say that because parents get nervous that their kids aren't getting enough dairy products. And you can also decrease sedentary activities like TV, video games. I hesitate to say reading because reading is very healthy for them in every other respect, but video games often compete with kids actually getting some exercise. There's a fascinating study that was published last year in Journal of Pediatrics on the use of probiotics for constipation. This is, of course, something that a parent or a worker would want to check with the child's primary care physician first. But in this study, babies taking probiotics had significantly more bowel movements than babies on a placebo after 2, 4, and 8 weeks. And the probiotic treatment had no side effects, or at least nothing that they could measure. Is that something that you should pursue on your own? No, but it's certainly something that you could talk to the child's pediatrician about or family practice doc. For independent toileting, which is another way of saying toilet training, the first thing is the ability to recognize the call to stool. It's extremely difficult when you're having a conversation with somebody, including a small child, most of the time, to be able to tell if they had a bowel movement 5 minutes ago, if they had a bowel movement 24 hours ago, if they're going to have a bowel movement in a little while. Most of the time we can't tell by looking at a child. Some children will have what I call the pee dance, where you can hear their shoes clicking on the floor. That's usually a good sign that they are about to void. That's a good time to take them to the bathroom. But just talking to a child about the call to stool, they usually don't have a clue what you're talking about. The child needs to be able to raise and lower their pants without help from an adult. They need to be able to get on and off the toilet or the potty chair, and this is why I said, again, either 2 steps or 1 wide step. And I say within reason can wipe. The reason we say within reason can wipe is that just because of the physical nature of it, lots of young children don't have the dexterity to wipe properly, particularly in little girls where you want them wiping from the front to the back, so that they aren't moving stool up into the lady area. It's just very difficult for them to get their hand around and back and do that. We teach kids what we call wipe, look, drop. When an adult wipes a child, the child often doesn't know what the adult is doing. They just often just think that that adult is just kind of smearing things around when they're not, when it's a very purposeful. If you wipe and then show the child the toilet paper with some discoloration on it, drop it in the water, and you wipe, you show it to the child with some discoloration on it, you drop it into the water. It's much easier for kids to learn using wipe, look, drop than it is to just hope that they understand what you're doing. Something that's not really talked about that much in the literature, but is at least as important as the child's readiness to be toilet trained, is the parent or caregiver's readiness. They have to have realistic expectations. I've seen kids where it took a year to toilet train them, sometimes even longer than that. I think that's not typical, but people that, for example, if a mother takes 2 weeks vacation from work so that she can toilet train the child, that's not a realistic expectation. Particularly, I might do that if the mom's, going to toilet train her 4th child or something like that, because she has a pretty good idea what she's doing. But it's very often the working moms who are going to toilet train the first child who they read something or they talk to some friends and they think that they can do it during the 2 weeks that they're on vacation, and that's not realistic. Previous experience getting toddlers to do things that they didn't want to do can be very important when it comes to toilet training. And good coping skills. Almost everybody that's toilet trained children at some time or other has found urine or feces on the floor. And I think it's John Roseman that has a program he calls Naked in 75. And what he proposes is that the parent leave the child naked from the waist down, and with the idea that they don't like the feeling of pooping or urinating on themselves, so that they'll stop doing it. The 75 in his program he says is for the cost of cleaning the carpets after you've gone through a couple of months of toilet training. And I just don't know many people that don't mind having poop in their carpets, but that's different strokes for different folks. Importance of modeling. The interesting thing, a lot of people talk about the importance of the child observing mom or dad using the bathroom. I think it's much more common with the mom, the dad, or the grandparents than it is a daycare provider. Most daycare providers would not urinate or defecate in front of one of the children in their care, and I think I'm in complete agreement with that. The important thing is that it happens whether we like it or not. I usually will say that I think that dad should urinate sitting down anytime the toddler who's going through toilet training is around, because too often when little boys are trying to urinate in the toilet, if they hear a noise or somebody calls them, when they turn to focus more on the fact that their name was called, they often will urinate on the side of the tub or on the wall, the wastebasket on the floor, just because that's just the nature of the little guys. If the parent labels what they're doing, with our own beloved daughter, she would sit down on the potty chair, clap her hands, and she was so thrilled because she thought that's what we wanted her to do. She thought we wanted her to sit down, when what we really wanted her to do was urinate in the toilet. So what we did was we changed it a little bit so that we would say, hear that, mommy's going pee-pee in the potty, or hear that, daddy's going pee-pee in the potty. It also is less awkward for fathers if they sit down to urinate, because they don't feel nearly as exposed as they do if they're standing up when they urinate right in front of one of their kids. Because I see so many kids that do not like to use restrooms in public, what we recommend is prior to the time that you start toilet training, the adults in the child's life, the mom and the dad or the stepmom, stepdad, whatever, that they start using restrooms at the preschool, at friends' houses, at church, at the restaurants. Just even if you don't want to, it gives a different message if the child observes that mom never goes to the bathroom except when she's at home. It's just fine for mom to do that, but sometimes it's very difficult for young kids about potty training age to hold it until they get home. They have to be able to tell that they have to go in order to be able to hold it. Here's a little trick that we came up with a number of years ago. Lots of children are almost terrorized by auto-flush toilets. I think part of it is the auto-flush. The other is the vigor with which they flush. But if you carry a little thing of Post-its, the 1 inch by 1 inch Post-it in your pocket or your purse, your briefcase, you can pull one of those Post-it notes off and set it on the sensor on the auto-flush toilet, and it won't flush until you pull the Post-it off, so that gives the young child who's going through toilet training an opportunity to use the toilet first and then wipe and pull their pants up and then put their hands over their ears, and then it becomes almost a game where you pull off the Post-it and watch the vigorous flush. Toilet training don'ts. Don't try to start toilet training before the child is ready. Don't try to start toilet training at an otherwise stressful time. We just a couple of months ago moved, and I was so thankful that we didn't have any little kids at the time of the move, because it took the moving company 3 days to do a move 17 blocks away. We moved from a 5-bedroom house to a 4-bedroom house, and we just had accumulated a whole bunch of stuff in the previous 33 years. So you don't want to do it during a move. You don't want to do it during a very big job change. My rule of thumb usually is that you do not try to toilet train an older child, a toddler, within 3 months of your expected due date for a younger brother or a younger sister, because it takes about 3 months for the average child to be toilet trained to where they're reasonably continent. And this illness in the family, obviously if you have the flu or something like that, you might postpone it for a week. But if there's any kind of a serious illness, it's just not a good time to try to toilet train a child. What role does punishment play in toilet training? It should play absolutely no role whatsoever. It doesn't play much of a role in the learning of almost anything else. If you've done anything from, and I hate to pick on something that's simple, because for a lot of people, whatever I say is simple might not be. If anything from learning how to use a computer to learning how to use a typewriter to learning to play tennis to driving a car to flying a plane, it's very, very unusual to have somebody get screamed at or slapped when they make a mistake. What punishment does is it introduces more stress and retards learning. So that, the notion that people have with some kids, they treat them like dogs, where, people will rub a dog's nose in if they peed on the carpet. And sometimes people are so proud of themselves because they don't actually rub the child's nose in the pee, but they verbally berate them. They're really, obnoxious with the child, and that does not facilitate punishment. That the punishment does not facilitate toilet training. It retards it. Infant toilet training. I actually bought the video and corresponded with some of the infant toilet training advocates in the U.S. What I caution people is I say it sounds appealing, but you should probably check it out first. The majority of infants who were toilet trained would reliably pass a stool after a feeding. They say on the videotape that it's not unusual for it to take a year to accomplish, to teach a 3-month-old how to use the toilet, and plan on lots of accidents. The source for this was a video that I bought from the infant toilet training people called Potty Whispering, the Gentle Art of Infant Toilet or Potty Training. And to my knowledge, as of April of 2015, there's no research in peer-reviewed journals supporting or not supporting the use of infant toilet training. The take-home message: don't start until the child and the caregiver are ready. Address any issues with constipation prior, I would say 2 to 3 months before starting the training. Don't be in a hurry to get the training done. And everybody in the house or the daycare center will be involved. And compliance is a very often overlooked component. There's a wonderful day program at I think it's called Boston Children's Hospital or Children's National Hospital in Boston, that brings kids in every day for about 6 weeks. It's usually kids that have had trouble with toilet training. But it's a wonderful program. The last time I read about it, they had toilet trained successfully over 450 kids, so I wouldn't be surprised if it's more than the neighborhood of 500 or 600 by now. If a friend or colleague is bragging to you about how they toilet train their child quickly or early, there are several things that are common for kids that are easy, and that's if they had a bowel movement reliably after feeding, they didn't have issues with constipation, the child was extremely cooperative or compliant, and there was probably a big luck factor. Here's the book that Allison Schoenwald wrote called The Pocket Idiot's Guide to Potty Training Problems. She's the one that has the toilet training day program at the Children's Hospital in Boston. It's a wonderful little book if people are interested in reading about it. Yes, this bold advertisement for one of my books called Elimination Disorder in Children and Adolescents. Unlike Allison Schoenwald's book, which is really written for parents, this is really written more for nurses and pediatricians, daycare workers. It's not really, it reviews research and talks about it in some fancy fashion. And then in 2006, the Agency for Healthcare Research and Quality published an evidence report on the effectiveness of different methods of toilet training for bowel and bladder that really has everything you've ever wanted to know about toilet training within the pages of that one report. Thank you. Now, I guess, Susan, I can open this for questions if people have questions. Is that right?
Yes, absolutely. That's right. I'm going to go ahead and take everybody off mute. So if you do have a question, you should be able to, as long as you're on an audio connection, to go ahead and speak up now. And I actually, Dr. Christophersen, okay. I was wondering as I was listening and thinking about the diaper banks, and the clients that they work with, the parents and the moms are so often working, and I know for me as a mother, something that caused anxiety for me was asking for help at the child care center. So I was bringing my daughter to daycare, and I wasn't sure if there was something that I should be asking them about their program, or do you have any recommendations for how to help working parents to, kind of set up that partnership with a daycare center so that everyone is on the same page?
I think the main thing would be within reason. I would try to toilet train at home the same way that they were trying to toilet train at a daycare center. I think it would be just confusing for everybody involved if, say, the daycare center was using Brazelton's child-oriented approach and the parents were trying to do toilet training in less than a day. If you have the parents and the daycare center doing the same basic procedures, I think it would go much quicker and be more likely to be successful. I think the daycare center would probably notice, because it's not that unusual for toddlers to either hold their urine or their stools for an entire time, either half day or all day that they're in daycare. And that to me is usually a sign that the child at least tends toward constipation, because nobody that has diarrhea can hold it for 6 or 7 hours until they get home. But coordinating the efforts between home, it's also entirely possible that in any decent daycare center that at least the director and 1 or 2 of the people working in the daycare center may have toilet trained 25, 50, 75 kids by now. So for a mom that's working and has never toilet trained a child before, sometimes the expertise of somebody that's already trained a whole bunch of kids at the daycare center, I think it just makes it easier for the mom if she listens to what they're doing. If they if they use punishment very actively, I would have real misgivings about that, since there's no reason to believe that the use of punishment will facilitate toilet training, and there's every reason to believe it would retard it. Mm-hmm. Next.
Hi, my name is Nora. I live in the Bay Area. I'm with Help a Mother Out. I'm wondering about rewards. Some parents give M&Ms and things like this as rewards for peeing in the potty and pooping in the potty. Is there any evidence that that works?
The interesting thing is that's one of the things that both Brazelton and Asser and Fox recommend is the use of rewards. I've heard people say that they don't like the use of rewards, but I'm not opposed to using rewards for something like toilet training where the child is learning or acquiring a skill such that you do not have to keep using the rewards after they're toilet trained. But since the 2 leading proponents of toilet training that everybody says are kind of contradictory, since both of them recommend the use of edible rewards, I'd say, if you're doing it the one way you use cookies, and if you do it Asser's way, you can use M&Ms, but I don't have any problem. We use rewards with both of our kids, and they didn't turn out to be greedy unnecessarily. Well, we're all greedy. Come on.
I like a cookie.
Yeah, absolutely. I particularly like chocolate chip cookies, but I have to eat gluten-free.
Oh, so or stickers. I think there are some cases, I think at my daughter's daycare, they had stickers, too, in the bathroom for the kids.
Yeah, but I think the use of rewards, if the use of rewards just facilitates the toilet training a little bit, it's worth it. You just don't want to get into a situation where, and I've seen this, where more with bedwetting than toilet training, where a parent will say if the child can go a month without wetting the bed, they'll get them a bike. And that's not a reward. That's a way of getting out of giving the child a bike. So that the reward, in order to be effective, has to be administered almost immediately after the behavior occurs. And I'm not buying the excuse that like a bike because they were toilet trained or anything like that. You want small rewards, preferably that are inexpensive or free, and they have to be delivered very quickly after the child engaged in whatever behavior it was that we wanted. That's a good question, though. Next. I guess you expect that from the Bay Area, though, don't you?
And in terms of night training, I've heard a little bit that night training is sort of impossible, that it's it's a hormonal shift that happens, and it's really challenging to night train, and you should just you shouldn't really do it.
Well, I don't know. To begin with, half of kids 3 years of age wake up wet in the morning. And anything that half of, I guess the technical, it's 46%, but that's basically half. Anything that half the kids are doing can hardly be considered abnormal. We routinely treat children who wet the bed at night if they're 7 years of age or older. But I think your basic point that you shouldn't really teach them, it's very common for children to be toilet trained during the day and still wet the bed at night. It's very unusual after toilet training to have a child have a bowel movement in their bed or in their sleep, which at least makes the cleanup much easier. But I agree that when you're toilet training kids, usually there should not be much consideration for being dry at night. Next.
Dr. Christophersen, I have heard that it's important to think about when you're planning the timing, when you were talking about moving or the time of year or disruptions to the home or family life, that when it's unhealthy to start and then stop. And I was wondering if that's true. If you start toilet training with a toddler who seems ready, but then for some reason if there's an illness, if the mom gets sick or something, is there any reason to be concerned about having to go back to diapers?
If it's any of the reasons that you just mentioned, like an illness in the family, something like that, is it ideal to stop and then start again? No, it's not ideal. Is it going to be a fatal error? I doubt it. The one thing is that if we have a situation where the parents and the child are equally frustrated, that the child is just not catching on, and the parents are getting, inside at least they're getting furious, I'm not opposed to what I call a moratorium, where for the next 30 or 60 days, there's no mention of rewards, there's no mention of toilet training, but usually that's because you've hit a wall, that the parents don't want to do it anymore, the child doesn't want to do it anymore. If that's not the reason for it, but in that case, like I'm saying, is that I don't have any problem with actually declaring a moratorium and just letting everybody just kind of relax. I've actually had some kids over the years that when you declared a moratorium, they started going to the bathroom and the toilet, but I don't know that, I wouldn't set that up as the expectation. So I don't think it's a deal killer to start and then stop and start again, but if you don't have to, and when you mentioned the seasons, it's probably easier to toilet train a child either when there's good weather like San Francisco, or I just came back from San Diego. I think it's probably harder when a child has on a snowsuit, to the child, you get the indication that they have to go to the bathroom and you have to rip off all of these clothes. I think that I usually encourage parents to wait until just about this time of the year. If their choice is between starting in January or starting in April, I would say start in April. Do I have any research to support that? No, that's just my personal opinion. Next.
And what about wearing pull-ups? And, I've heard that pull-ups, some kids get tricked because they feel too dry, that you should shift them if you're trying to train to training pants where they feel wet.
Brazelton never mentioned it, but that's because his research was published in '62 and there weren't any such thing as pull-ups or training pants in 1962. When Azrin, in his training methods, he recommends training pants rather than pull-ups for exactly the reason that you just mentioned, that it's much easier for them to feel the wetness than. And I've seen things. I'm quoted on the internet as being in favor of disposable diapers, and while I appreciate the accolade, I don't know that I've ever been in favor of disposable diapers. I've toilet trained kids in cloth diapers. I've toilet trained kids in disposable diapers. main thing is it's much easier with training pants for the kids usually to get their pants up and down. And one of the things that Aspen recommends in toilet training in less than a day is that you make a small cut, not a big one, but a small cut in the waist of the training pants, because sometimes the elastic is too tight and it's hard for the kids to get them up and down. The problem with pull-ups is that, the problem with diapers is that they, are put on with adhesive strips, and sometimes it's just hard for the kids to get them off. But if you put them on loose enough that they can get them off, then when they walk across the room, the diaper just slowly slides over the bump and heads toward the floor. So I think using training pants is probably better than using pull-up, except if the child has an accident in training pants, it's not only more noticeable to the child, it's more noticeable to the daycare provider, because they're more likely to have some pee outside of the pull-up. Next. I don't say next to be rude. I just want people to be able to get their questions in if we have time. You can ask a follow-up question if I don't answer your question, too.
I feel like we actually heard from anyone. Is there anyone else who has a question? Okay, well, if you have a question, you can always follow up by sending us an email or calling, and we know how to get in touch with Dr. Christophersen, so we have access to the expert. And I just wanted to say thank you to everyone for attending, and especially thank you very much, Dr. Christophersen, for sharing your expertise and your advice. I know it comes from many years of research and experience working with children and getting through all kinds of problems, and I think it's a really great topic that diaper banks can sort of use to reach out to the families and kind of help them, because they're all going to the diaper banks for diapers, but eventually, hopefully successfully, they all eventually don't need
diapers anymore. And almost a parting comment is I think that toilet training is the most difficult skill for children to acquire between the day that they're born and the day that they're potty trained. So that when I say that parents have to have realistic expectations, they really do, because it can be very, very frustrating to clean up after kids for months on end.
Yeah, and that's really valuable advice, I think, that our diaper banks can pass on to those families. Yeah, and I also wanted to add that the webinar was recorded, and it's going to be available on our Google group, and the slides will be made available, and I'll follow up with a link for everybody. And I want to say thanks again, Dr. Christophersen. Thanks, everyone.
Thank you. Bye-bye.
Bye.
Thank you.